Hello, everybody. Folks who are listening remotely, can you hear me? Can you check on if the audio? Okay. So hello, everybody. Wow, this is amazing to have so many students and friends and colleagues and all here to Community Cafe. I will be telling you about some work that I've been doing in Kenya. And I welcome and invite questions and discussion and disagreement and all of that. I'm not going to get too deep into the science of the research. In some respects, what I'm going to be talking about is translating research into practice of global environmental health. So this is called Sustainably Producing and Providing Safe Drinking Water in Kenya. Asterisk, and the asterisk is that, and then I'll just briefly mention a couple of other water-related projects that I'm working on and not get into them, but just so students are aware of other water-related research going on in EOHS. One is a study of lead in drinking water. And as you all know, anyone who's taken introductory EOHS, that there's no such thing as a safe level of lead exposure, especially in children. But in rural parts of the United States, many homes rely on wells on the property, private wells for drinking water, and those are unregulated. So nobody knows if there's lead in their water or not. So we're doing research in 5 Illinois counties to characterize the problem and to randomize people, households, to several different interventions to reduce the lead in their water. Another one is a study funded by the US Office of Naval Research. Navy divers go on all kinds of missions in hazardous conditions. They sometimes have to dive in places where there is all infectious agents, sewage, all kinds of other stuff in harbors, and they're looking for ways to predict the risk of illness for people who are diving, swimming, without measuring water quality, because there are all kinds of fancy instruments and devices, and the Navy gets lots of people trying to promote their devices and saying this is the way that you could sense, use a sensor to detect microbial hazards in water. And we're using a machine learning approach. So this is in collaboration with 3 computer scientists, 2 here and 1 at Kansas State University, where we use tons of data about water quality, including water quality measurements that we make here at UIC, Dr. Shrestha's laboratory. And then there's a whole bunch of other water-related work that hopefully you'll hear about when Dr. Shrestha gives her talk at some point. She does a lot of cutting-edge microbial, environmental microbiology for COVID and for other things in Chicago water. So you'll hear more about other EOHS water research. So that's the end of the asterisk. Now we're back to providing safe drinking water sustainably in Kenya. So students who are in EOHS 594 know about the Global Burden of Disease Project and will recognize a map like this. This is the number of deaths of children under age 5 years due to unsafe drinking water. And you could see that the countries that are lit up in the yellows and oranges and reds are primarily in sub-Saharan Africa. And in addition to death, obviously there are a lot more hospitalizations. There are children who get recurrent infections and become stunted. Their growth and their cognitive development are impaired. So beyond the number of fatalities, which is horrible, there's a much larger overall burden of disease. So how do people get their drinking water in much of sub-Saharan Africa, as well as rural parts of other countries in other regions of the world? So these are pictures that I took on my first trip to Kenya. You could see somebody is filling a plastic jug, a jerry can, with surface water. So most people in the world get their water either from surface water, like lakes and rivers, or groundwater, like aquifers, although more and more people are getting water from desalination now. But people get their water from surfaces, which is very contaminated. They bring it home, and it sits in the home. Um, yeah, it gets to the home, and then it sits in storage. And then when people want to drink it, it often gets transferred to like a clay pot, and it might get treated. It might be boiled. It might be chlorinated. It might be filtered through like a cloth. There are a variety of treatments that might happen, or it might get consumed without treatment at all. And the bacteria levels in this water are sky high. So how do we get our water safely in Chicago? We have centralized drinking water treatment plants, big facilities that water comes in, and it's goes through a bunch of treatment stages. Ultimately, it's disinfected in Chicago with chlorine, and then it goes out into a piped network to your home. These are few and far between in low-income countries and in rural areas of middle-income countries, because the capital costs building these things is massive and sustaining them is massive. There have been all kinds of projects that were built, drinking water treatment plants that were built with donor funds, and they get built, but there aren't funds to operate them and to maintain them and to repair the sewer, the drinking water pipes. And there's corruption. There have been big ticket item projects like this that have been ordered and funds arrived in the country, and no one knows where the money went. The drinking water treatment plant never got built. So for a variety of reasons, these are not the preferred approach right now in global development. One approach that's been promoted for about 25 years is point of use drinking water treatment. So that means taking, you see on the left side, chlorine drops, and it's sort of like one capful per jerry can per 20 liters. And then there's something called SODIS, solar disinfection, where water is in bottles, a certain type of plastic, and it lets ultraviolet radiation in, and the combination of the heat and the UV is meant to kill bacteria. Another approach is ceramic filters, and this says Saramaji. This is in Kenya. Sara is like ceramic, and Maji means water. So this is like ceramic water. So it's like these clay pots, that's the ceramic part, that have these tiny pores. Some of them also have silver nanoparticles in the clay before it's baked, and that has antimicrobial properties as well. So these are some of the main point of use drinking water treatments that have been promoted. The problem is that they don't work so well. Either you have to keep buying chlorine. People really don't like the taste of chlorine if they've never had chlorinated water before. One of the faculty in HPA, Jess Rothstein, she's published work on that by doing sort of ethnographic research and finding out why this very effective treatment of water is there's very little uptake and it's not sustained. The solar disinfection is not very effective, and again, it takes time. That takes hours before the water is somewhat cleaner. And you know, when researchers are around watching how it's going, it works pretty well, but several months later, people aren't using it anymore. And then the Saramaji and things like this, ceramic filtration, it takes time. And the pots have to be sort of washed out, and it's fairly effective, but again, adherence is the main issue, the main challenge. Now, ozone is another way that drinking water can be disinfected. Ozone is a very potent oxidant, and ozone in water generates other even more powerful oxidants like the hydroxyl radical. And the World Health Organization issues guidelines, maybe once every decade or so, about drinking water treatment. And what they said is that ozone is not recommended for household water treatment because of the need for a reliable source of electricity to generate it, the complexity of generating it, how to dose it, and its high cost. So ozone is used in more and more drinking water treatment facilities, centralized big places for drinking water and wastewater in the United States and in Europe and in other high-income countries. But it takes a lot of electricity. There's this corona discharge method, and you need high voltage and reliable electrical supply, and it's a big facility and it costs a lot to build. There isn't really a way to provide ozonation at like a household level. So that's no longer true. There is a new technology that was developed by two electrical engineers at the University of Illinois at Champaign-Urbana. You may have heard of that. We're the main campus. They're like the, downstate one. And it uses something called a microplasma. So when we were all in school, we learned about the three states of matter: solid, liquid, gas, right? And it turns out that the fourth state of matter, called a plasma, which has been described as like a sea of ions. So imagine like the protons and the electrons, instead of like, the electrons circling the nucleus, imagine the protons and the electrons are just like a sea of ions, charged ions floating around, not connected to each other. That's what the sun is. The sun is a plasma. Lightning is a plasma. And these electrical engineers found a way to make what's called a microplasma. So if you run electrical charge through an aluminum block in a certain way, you can create a 2 microliter volume plasma. So imagine like a skinny tube. When air goes through that plasma, the O2, the oxygen, the molecular oxygen becomes O3, becomes ozone. And this little device, it's about this big, is efficient enough that it could be powered by a solar panel. So you actually can make ozone at the household level, and that wasn't the case when the World Health Organization was written. I should state at this point that this was patented by
please.
And commercialized. And when I publish material about that, I have to declare a institutional conflict of interest. So even though the University of Illinois is my employer and they have intellectual property rights and commercial interest in this, I don't, okay? I just use this stuff. But I met one of the professors, Sunjin Park, at a water technology conference in Tel Aviv, Israel. We never met each other in Illinois. I didn't know about his work. He didn't know me, but we met at a conference and he told me about this and he, showed me the little box and I said, I got to try this. So I brought it back to UIC and we tested it out and we got sewage from our friends at the Metropolitan Water Reclamation District, and we disinfected it using ozone. So ozone comes out of that little box in a tube and it bubbles through water, a water sample. And this thing on the y-axis, log reduction values, this is how like civil engineers measure efficacy of drinking water treatment or wastewater treatment, that like a 1 unit decrease is like a 10-fold decrease. So log 2 would be a 99% decrease and log 3 is 99.9% decrease. And we put viruses in the wastewater and we measured E. coli, and we measured enterococci DNA, and we measured this virus that we put in there called a coliphage, and it seemed to work really well, even though it was pretty it was a very cloudy solution, I guess. So that's much harder to disinfect than, let's say, a clear solution. The turbidity, the particulates in the water make it hard to disinfect.
So to have safe drinking water, would all you have to do is double ozone through it? Because even if that killed microbials, you still have basically the waste that they produce, and then the destroyed microbial bodies that are still in. So you still have to filter, right?
Well, you would need to. I mean, well, first of all, ozone kills bacteria. Bacteria aren't the only and viruses, but they're not the only things in water, and they're not even the hardest things to kill. Parasites like Giardia and Cryptosporidium are harder to kill than bacteria, say. And then there are metals and organic compounds in water. So definitely, I would never say that all you need to do is bubble ozone through it and then the water's safe. But your point that, killing the bacteria is different than making water safe is absolutely right. And we could have used you on this project, because we did end up finding, there are well-established ways to make the water clearer before you get to the disinfection state. So it goes through filters. Maddie?
But ozone can change the chemistry of person.
Yes.
Make them more toxic.
More or less, or precipitate out of solution. So if you didn't hear, so Dr. Amoy Turkmahala said that ozonating metals can change the valence, the state of the metal, which could make it more toxic, less toxic. It could make it more likely to react and combine with the particles that you then filter out. So it's not simple. So having tried this in the laboratory and seeing how well it really did work and how user-friendly it is, you just push a button and it goes. I began testing it out in Kenya. There's a retired emeritus faculty member from EpiBio, Dr. Bob Bailey, who's been doing work in Kisumu, Kenya for like 20 years on HIV prevention, especially by using male circumcision as a way to prevent HIV transmission. So he was sort of, without him, I never would have known about Kisumu, and I wouldn't have known where to begin, but he's worked with IRBs there. He knows where to get coffee there. He knows, what are the non-governmental organizations that do water research. So because of him, I was able to sort of hit the ground running there and got started testing the water. And at first, here you see two of these ozone generators. Each one is connected to a solar panel, and we have 2 containers of filthy water, and started testing it out like that.
How large are they? The size of your hand? Because the original picture they look big, but here they look much smaller.
They're about this big, and maybe about 2 inches thick, kind of like a fat paperback book, maybe. And so doing those tests of the filthy, non-filtered water showed that we were able to effectively kill all the E. coli that we could measure, and we moved on to trying it in people's homes. So a lot of the homes don't have electricity. They definitely don't have running water. And they use filthy surface water as their drinking water source. And, I went through an IRB process here, and I went through an IRB process in Kenya, and asked people to ozonate their water before they drink it. They don't have to change whatever else they're doing. If they're chlorinating, if they're boiling, we don't want to make the water less safe by saying, don't boil your water, instead do this. So whatever you do for your water, keep doing it, but ozonate it first, but before you drink it. And so we ended up comparing the household stored drinking water, the stuff sitting in those jerry cans, with their water for drinking. We weren't in their home watching what they do. We weren't making like paired comparisons of, what was in this water before it was ozonated and what was in their water after it was ozonated. We wanted them to do whatever they do without us looking over their shoulder. And you could see that the household stored drinking water had, if I were grading this, I would take points off because there isn't a good label. You don't even know what we're looking at. So it's the levels of E. coli in the water. And you could see that it went from like 840 something on, median to like 80. So like a 90% reduction. Not disinfected, not sterile, not safe by US EPA standards or WHO standards, but a pretty big reduction. And this is in addition to whatever they were doing anyway. We did some qualitative research. We interviewed household members, males separately from females. We wanted to hear what everybody had to say about it. The thing that was definitely the most popular was the solar panel, because people could charge their cell phones. And when you do research in global health, sometimes people do this like willingness to pay research, like how much would you be willing to pay for clean water? How much would you be willing to pay for this or that? People who are not willing to pay for safe water pay their cell phone bills. People value cell phones more than water in many places. So they loved the solar panel because there's a port where you can charge things and you could run lights and do all kinds of stuff. So the most popular thing was the solar panel, but people liked the water too. Everybody said, can we please keep this? We want to keep doing it. All kinds of anecdotal stuff like, oh, I used to have stomach aches, but now that I do this, my stomach is fine. So people liked it. The E. coli level went down 90%, but not enough. The water was still pretty turbid, pretty cloudy, so that limits the effectiveness of any disinfectant, including ozone. And it wasn't really very the best use of resources, because we provided these units, which cost like at that time about $300, and they were used for a couple hours a day. And that if we were to come up with a way where we could be using them more for multiple households at the same time, the sort of per unit cost of disinfected water would go down. So basically, we built a water treatment plant, this is what's called decentralized drinking water treatment. It's sort of halfway between the big centralized plants, like we have the Jardine plant in Chicago, and that point of use where people are supposed to like boil or put drops of chlorine in their water. And this is from a paper published with the first author, Colin Hendrickson, an MPH student from EOHS a couple of years back. He now works for the US EPA. This is what the first site looked like. The buildings were already there. They belonged to the NGO that I work closely with, called Safe Water and AIDS Project. And using the structures that were there, we had solar panels put up in a place. We had tanks put up. What you see in the upper left there are actually 4. You can only see 3 there of those ozone generators. And this is the people in the picture here are some of the people from the NGO, as well as some people from the local water authority, Kiwasco, the Kisumu Water and Sewerage Authority. And they wanted to see we wanted them to see what we were doing. As the water moves through the process, there are filters and things like that to get all the almost all the particulates out. and the whole thing runs on solar power. So we have a pump at the river, which is about 100 meters away, and the pump moves water to this upper tank that you see here. And that's what requires the most electricity, is the pump, not the ozone. But it's all solar, and this is like the kiosk side of that same site, where water is sold through that window. So people work there, they have a job, and the price is set by the local authorities. We don't get to decide how much to charge for, well, we could always charge less, but they set the ceiling, which is about 4 cents per 20 liters. And people can either buy a jerry can, but more typically it's like a water refill station. People bring their empty jerry cans and get them filled with clean water. And then the other thing you see on the left is a water vendor. So these are water resellers, and they buy our water at a discount, and then they set their own prices for essentially the delivery service. And the farther somebody lives from the kiosk, the more the vendor charges. So they're not part of the project, but they're a big source of revenue for the treatment system. And this is from Colin Hendrickson's paper. You could see that, so we instead of having one disinfection unit, one of those orange boxes for one household going for 3 hours, we've got 4 going for, in this case, we were looking at 4 hours. And the raw water starts out at the upper limit of quantification, above the upper limit of quantification of E. coli. And then turbidity is the cloudiness, the amount of sort of suspended particulates in the water. So before we get to ozonate, the water goes through the filters. And you could see the turbidity goes down dramatically, and the E. coli goes down dramatically, but we're able to get it down to 0 during the disinfection process with ozone. So it seemed like it works. People really liked the water because the alternative in that community is groundwater, and groundwater has all kinds of naturally occurring stuff in it, like salts and sulfates and things like that. And people don't like the taste of the groundwater, but they called our water sweet. They said, oh, it tastes sweet. It would be like Chicago water, or Lake Michigan water without all those salts. So they liked it. They were willing to pay for it. It generates revenue, provides employment, but the system was pretty clunky. The way we had solar panels on this building and a kiosk there and tanks there, and we try to make it more modular. So this is what the second site looked like. Let's see. Oh, I might need to. Do I have to share the video? No, I know. Oh, okay. So got it. What? It's already on the. Yeah. Let's. Yeah. Here, let's go to. Yeah, I could see that's what we're working in. Oh, wow. Of course, I always read it. Okay.
Chrome has downloaded it. You can see it's open on the bottom, so if you just try to copy the link and open it, that might work.
Actually, I could make it simpler because I know the website. Um, All right.
I'm Sam Dorovich from the University of Illinois Chicago School of Public Health. Solargy team members in the US and Kenya are thrilled to see this solar-powered system meeting the need for safe drinking water. Not only do community residents benefit from the water, some are employed to work at the kiosks and their salaries are completely covered by sales at the kiosks. We look forward to establishing additional and larger Solargy systems so that communities elsewhere can produce safe drinking water sustainably.
Microplasma was developed at the University of Illinois, introduced microchip scale reactor that using the ambient air to produce ozone that can kill various pathogens in the drinking water. Furthermore, the technology using the low power, so it can be using as a battery power or solar power solutions in the remote side. And the unit is very easy to maintain by local people.
Now, we resonate the water using this EVs. This process takes around 30 minutes, to completely treat 500 liters.
Generation only pima wati yongo. Saniwa niko pima le. Newa umupima por. Mwanya lutigo kata mwanya. Mamondo na wachukuru ne 3 kilometers. Kuro saniwa yudo pima chiegi. Okwanya mse ubipia ura mwini sana.
Bueno, el pino se le va a hacer la copia. Para no la luego ahí piden como ya lo que no puedo decir el pino no también gasta más la verdad muslimo ande ahora también salir para todo se muy bien pero la ya
Main issue is sustainability, and that's why when my office was incorporated, we even trained community. Right now, we even have a water management committee running the scheme. By the end of the day, when SWAP will be out of the picture, I believe that there will be sustainability.
I also want to appreciate the technology that is used by solar purification system that ensured our people are now drinking safe and clean water. It's been for so long, and people have been taking contaminated water and not really safe for human use. As we speak, people are being happy and enjoying safe water.
Okay, so that's, you saw like site 2 that it was more simple, modular, you know, it was just like this one tower with the tanks and the panels, and it's built on top of the kiosk. So Dr. Ziegler, Don Ziegler teaches a course called Global Health Solutions, and he talks about 11 elements of program success in global environmental health. So I didn't take Dr. Ziegler's course. I had to like learn the hard way. But to make all that happen, like people in universities here can't come up with a brilliant idea and just say, hey, somebody ought to do this somewhere. You know, you sort of have to go and you have to meet people on the ground who know communities and who are dependable and know local government agencies and know how to know the ropes. We had to go through so many permitting process for this. We had to get hydrologic surveys done. How much water can we abstract from the river? How will it affect communities? we had to have the National Water Authority or the National Board of Standards test our finished water to make sure it met local drinking standards. So I would know none of that. I wouldn't have been able to do anything except like push the ozone on button. But by working with an organization called the Safe Water and AIDS Project and the Kisumu County Ministry of Health and the Ministry of Water, Environment, Climate Change and Sustainability, we were able to do a lot together. So I think it's like a great example of like an academic, NGO, local government, community partnership. We formed formal community-based organizations that are now responsible for the operation of these kiosks. So they don't belong to UIC, they don't belong to SWAP, the Safe Water and AIDS Project. There's a board, and one of my favorite moments was being at a community meeting with the village chief and elders and UIC students, and talking through how it's going and what they need. So next steps and opportunities for collaboration. I've been trying to collect data about the amount we spent up front, the capital expenditures, the amount we spend on an ongoing basis, the payment to the people who work there, and the sales, the revenue from water sales. It's been very difficult because getting the data is the challenge. That everybody's main priority is to operate the system and to sell water, and not necessarily to collect data. So we're working it out. We have like something like Qualtrics where people are just supposed to enter data in real time, and then I see it here. It doesn't really work so well. And we really need to move to remote sensing so that how much water comes into the system, how much water goes out, how many shillings are coming in for those sales, and then water quality. Sometimes the only way we know that there's a water quality problem is because it comes out not looking so clean, or ozone is an irritant, and it has a bad smell. It can make your eyes water. It can make you cough. We want to be able to know before we have a problem. We want to build a larger site, a larger system that's modular and scalable in a different part of Western Kenya. One of the things that is very common in sub-Saharan Africa is phone-based cash transfer platforms. So you don't need a smartphone. It's sort of like being able to text, and like you could spend money or add money to your account. And we use that, and there's some people in Kenya who want to make like an automated system where you just like scan your card and then you get 20 liters of water. Emergency response, I think that this has potential to be useful for emergency response. Right now, there's a big cholera epidemic in Malawi, which is 2 countries south of Kenya. And there are cases of cholera in Kenya right now. So being able to deploy sort of a solution in a box, we're probably going to build one in like a shipping container or small shipping containers. That's sort of a next step as well. But not to exaggerate the benefits. I mean, putting chlorine drops is quick and simple and cheap. So it's not like Malawi needs this, but just putting chlorine in water that's high turbidity is only somewhat effective. One of the things that I've learned is that, I shouldn't say one of the things I've learned, but one of the general principles of global health and global development is that having entrepreneurs who are highly motivated is really important, and that this could potentially be like a business to build and sell and distribute and maintain these systems. So we're kind of thinking about that. Studying more about what the ozonation does to parasites and to organic compounds is another potential step that will go in. And obviously health research, you would be surprised, but for all of the decades of use of point of use drinking water treatment systems, there's almost no good data showing that it prevents childhood diarrhea, even when it's combined with education and sanitation interventions. And maybe it's because the scale of community level treatment would be better than household treatment for a variety of reasons. So I don't know how many of these things are going to happen, but that's where I want to go. This is 2 weeks ago. I was in Dubai getting an award with Alex Mwaki, my collaborator he's the executive director of the Safe Water and AIDS Project. And I can show you, let me see. So it was amazing Dubai is a surreal place to begin with, but it was even more surreal. We were at an awards ceremony with about 10 other teams that had done global innovation projects that received awards. And this is Burj Khalifa, the tallest building in the world. So we're on a fancy hotel terrace opposite Burj Khalifa at our awards ceremony. And hang on. No. Burj Khalifa is all lit up. And yeah. And the award ceremony starts, and yeah. Okay, so questions, ideas, Nicholas?
Yeah, so I was wondering, like, does the treatment is always the same throughout the year, or does it change? The water change during the season?
The water does change during the season. So a lot of Africa has seasonal rains. A lot of Asia has seasonal rains, unlike Chicago. And when it rains, all kinds of sediment and soil and sand get into the rivers, and it makes the water much more difficult to treat. The short answer is no. Our treatment system is kind of designed to be easy to operate, but it could certainly be more data driven and optimized so that we're doing less treatment when the water's sort of higher quality and more treatment when it's worse quality. It's never good though. I mean, it's always bad. You know, there's animals around the rivers. There's, you know, if it rains heavily, there are latrines. You know, Kenya is pretty strict about open defecation, and that when you build a house, you have to build a latrine. But still, when there's heavy rain, water can flow from latrines to surface waters. So no, we use the same treatment all the time. But that's just because we're not very sophisticated and, you know, don't have. So what are your thoughts as a somebody with a background in engineering? What do you think we ought to do?
Just sort of, I was in the field, but you can treatment plan on one day and the children got. This was a big treatment plan, so I was wondering that
Right.
in a treatment plant like yours, how do you manage that?
Yeah, we don't manage it. We just do the same thing every day, no matter what's going on. Yes, and then yes.
My question is, so are there any impacts of, obviously this is very new technology, but being exposed to microplasmas or, you know, ozone can be toxic to health as well. Is there any health effects from that we've seen so far? Any headaches or dizziness, or I don't know, when you pull the tube out instead of it filtering through, like?
Yeah, good question. So ozone is complicated, you know, and EPA has a hard time communicating the idea about, like, well, in the ozone layer, ozone's good. We have a hole that's thinning. We need more ozone, but we have ozone action days, you know. So there's the bad nearby, good up high. That's sort of an EPA communication. And ozone definitely nearby can cause things like asthma attacks and exacerbate chronic pulmonary disease. So we definitely, you know, there are no like tight buildings in these villages. So we did definitely ask people, like when we had the point of use deployment in homes, like, have you had any eye irritation, throat irritation, cough, stuff like that? Nobody did. Ozone is, because it's so reactive, that like it doesn't linger. It reacts rapidly with just about anything. So there isn't any residual ozone in the water. That's kind of a bad thing, because one of the advantages of chlorine is that it stays in the water. There's chlorine residual. So when we have folks dispensing water in those jerry cans, even if it leaves the kiosk sterile, it's going to be in houses. Kids are going to stick their hands in the water. All, you know, dirty cups and ladles might be used. So actually it would be good if there were a little ozone left over, but it's too reactive to persist. So I don't think health effects is an issue. I mean, like I said, the World Health Organization and EPA, you know, have no issues with ozonation as a means of disinfecting water. Microplasma. I'm not sure what the potential issues there are. I mean, thermal and non-thermal, but it's not like it's radioactive or anything like that. So not that I know of. Another question?
Nice portable kind of unit that has the so it becomes better, it becomes more compact. My question is, since all the sources of water seem to be quite dirty,
Yes.
so there is not a single processing which can have some kind of a catchment area where you can let the water that become the sediment, and then, you know, big load is taken up.
Right. So the question is there a way to help promote the settling of the particulates in the water? So that we do that in the first tank. So it settles overnight, and then we use alum for coagulation and flocculation. But you know, you don't have to do that for groundwater. You know, groundwater could be, you know, if it's groundwater under the influence of surface water and we have to worry about bacteria getting into that, it could easily we wouldn't need that whole treatment train for disinfecting groundwater. It could go straight from the aquifer to disinfection, in our case, ozonation. But that doesn't solve the problem of the salts and the sulfates and the things that people don't like in the water. There's also places in Kenya that have high fluoride in the water and high iron in the water. So those are downsides of using groundwater. And then finally, depleting the aquifer is a major issue. So, you know, this system is sustainable because it's solar, but it's also sustainable because we're preserving groundwater reserves by not drawing from boreholes. Yeah, no, yeah.
At the end of the process, there is no testing. So, already standardized in such a way to know that the board has been definitely clean, or you need to.
We do. I mean, we periodically test. I mean, at the beginning, we tested every day. You know, and then we tested a few times a week. And then, you know, once we understood the performance of the system, we just check like once a month, unless there's somebody suspects a problem.
It is meant to be very nearly the same procedure that over time you need to test and see whether the system is working as efficiently as it was in the beginning.
Well, the ozone generator has the high tech part, which they call the chip, the microplasma, the channels in which you know, molecular oxygen is converted to ozone. That doesn't really fail. The things that fail are there's a small fan to keep it cool, and there's a small pump, and those things fail after a few thousand hours of operation. So my colleague from Champaign, Sung Jin, you know, when we were out there, he taught the team in Kenya how to take apart and put back together the ozone generators and replace the pump and replace the fan. And then the team out there, they came up with a sticker that they put on the ozone generator that says proudly assembled in Kenya. So definitely there are maintenance issues, but they're not major. Mehdi?
Presentation, the new ozone generator, what's the advantage over the current ozone generator in the market? So like it's cheaper?
Well, it's small. It's small, and it's low power, so it could operate on solar. You know, that's the advantage. Yeah. Dr. Malecki.
Yeah, thanks so much for that work. You can see all the exciting things coming out of USC. So thinking towards the future around sustainability, I was struck about surface water and the sustainability of that you're taking surface water. Are there plans to build it out so that in periods of drought that there would be water on reserve? It seems to me one of the systems thinking person in me jump to what happens if there's a drought and there's no water in the river. What do you do that?
Yeah, well, these particular rivers have flow year round.
Okay.
That was part of the reason we chose those. We went through a long site selection process before settling on those. But people use rooftop harvested rainwater commonly in Africa. So if they have like a corrugated tin roof or something like that, when it does rain, they have 10,000, 5,000, 10,000 liter tanks that store that. And even though it's rainwater and it's not impacted by sewage, it's not so clean. You know, there's bird poop on roofs and all kinds of things like that. So we also store rainwater, and we can, make it available. But if we were located at a place where it's only a seasonal river, then we'd have no water to produce in the dry season. Yes, Hanyuk?
Also,
I was wondering this from the state, because of the drinking water quality issue that came down when it comes to climate change. I suspect the drinking water quality in some area might be getting worse, or maybe they're getting better in some area. So I was wondering.
I don't know about like time trends in water. Do you mean like surface waters and groundwater, or do you mean like finished water?
Is this so overall related to drinking water?
Well, one of the, as you know, better than anybody, the general rule about climate change is that wet regions are getting wetter and dry regions are getting drier. And in Kenya, there are areas that are already drought prone and they are getting drier. And there are areas that, get reasonable amounts of rain, even though it's seasonal, and those are getting heavier and there's flooding. So there's definitely climate related challenges on both sides of the water availability challenge.
All right, I'm sorry, we gotta call it to a close. Thank you so much, Sam. That was really interesting.
Yeah.
Where you're keeping your award?
Well, first of all, the $120,000 was the prize, so that's going